And the best thing is going to look natural, and you're just going to look great.
Yes.
Yeah. Okay.
29-year-old Angela Lear used to look great before she had children.
I love them.
But she says her stomach just isn't the same.
They stretched it out really far and left me with a lot of loose skin.
But Angela is seeking the help of Dr. Walter Tom, located in Santa Rosa and Napa.
A lot of mothers are a little bit upset about the changes that have happened to their bodies after having these little bundles of joy. And a lot of times what happens is they lose volume in their breast, so they begin to see a drooping of the breast. They're beginning to notice that sort of that middle bulge.
Dr. Tom is performing a mommy makeover, but patients of Dr. Tom will not have the traditional downtime, will not have a long scar, and will not have to go under general anesthesia. It's a conscious mommy makeover. You're awake the entire time, but feel no pain.
The results have been phenomenal.
I am so thrilled with them. With the C-section scar, obviously that's still there, but the skin that hangs over the top is gone. When I wear my jeans, they fit more comfortably, they fit a little bit looser. When I hold my children, I'm not self-conscious about my shirt coming up and the skin hanging out, and I feel like my body fits me.
Part 1 of a mommy makeover is a technique called Smart Lipo. It literally melts the fat and tightens the skin. How you feeling, Angela?
Feeling great. Don't feel a thing.
You look great.
Thank you. I'm excited.
Doing all right, Angela? You just not talking for the cameras?
I'm doing fine.
Great.
Thinking about taking a nap.
But we spend just as much time with the laser fiber underneath the skin, moving it back and forth. In fact, I take just as much time applying laser energy to the undersurface of the skin. So by doing that, we'll actually get the skin to tighten initially, but also what it does is it causes a temporary damage to the collagen of the skin so that it will rebuild stronger.
Dr. Tom says the laser energy is much like lifting weights. You work out to tear down muscle fiber, then it rebuilds firmer.
And what's really nice is for a lot of these mothers, for instance, who have the looser skin, instead of requiring a tummy tuck, which requires a longer incision, we're doing this all through little needle entry ports.
It's the size of a ballpoint pen. Something this small can give you a whole new contour and a whole new level of self-esteem. Angela wanted another part of the mommy makeover after the great results with her abs and skin tightening.
Having kids and being pregnant and all the changes with the body, I lost my breast volume all the way. General anesthesia was just not something that I was willing to do with having the 2 kids, and just having to have to explain to them why mommy's down for a couple weeks.
Angela is also having a conscious breast augmentation. She is awake and can decide what size fits her body best.
Okay.
Nice.
So now you can kind of see it there.
Yeah.
And so the question is,
I had the procedure on a Wednesday. By Friday, I was doing a little bit of gardening, and by Sunday, I had dinner with friends, and on Monday, I was back to work.
And that was important. Angela is a full-time nursing student, a full-time mom, and works outside the home.
abdomen here, we can see this here, and as we can see this in here, and then you want to pull it back.
But she knew she would be in good hands with Dr. Tom. He was chief surgeon at Santa Rosa Memorial Hospital for many years and founded the Aesthetic Laser and Vein Center of the North Bay in 1999.
I was a general vascular transplant surgeon for many years, and now I'm practicing cosmetic surgery over the last decade. And I have to tell you that it's been extremely rewarding. The patient's self-image is so much improved. They just feel better about themselves. It is extremely gratifying to have them coming in, and they've got a smile on their face.
And Dr. Tom gets to know his patients to give them their best results.
Part of our mission statement is that we want to improve patients' self-image and self-confidence through education, besides our advanced technology. And so education is really important to us here. And so what we'd like to do during the consultation, our one-on-one consultations with the patients, is I show them a good number of before and after photos. And these are our patients. They're not the company's patients or other physicians' before and after photos. These are our photos. And what I try to do is I try to match up some of our patients with maybe similar issues to the patient that we're consulting with, so that they can get a very reasonable idea as to what their expectations of results will be.
He makes me feel very comfortable about my body both before and after the procedure.
Dr. Tom gives you a better body without the risk and downtime, so you can spend more time with those who matter most. On your Health Watch, I'm Melinda Meza.